Hi, everyone. I'm Christy Collins. I run the MCM network. Thank you for joining us. We have here today Dr. Bryan Sisk and Anna Kerr from St. Louis Children's and WashU, which are related institutions, and they are going to tell us about a resource that they are developing. I'm sorry, I'm admitting people from the waiting room while I introduce. Um, called VAccess, I believe is how we say it, and I'll just let them get started.
Thanks for having me again. I was bugging you just a couple months ago. So I'm a pediatric hematology oncology doctor, and I focus on vascular anomalies. And Anna, you can introduce yourself, and then we'll get rolling.
Yeah, my name is Anna, and I am a communication researcher. And I also was born with a vascular anomaly, and I have also been doing this research for several years now.
Perfect. So we're going to talk about this resource that we've developed, but we also want to talk a little bit about why we're doing this work. And Anna, you can just advance the slides for me. Um, One thing to say is that uh, a really important point for anybody who has MCM or who cares for somebody with MCM is that you deserve to have multi-specialist expert care and to have a medical home to help you get the care that you need. I know a lot of families struggle to find this, but just wanting to say out loud that like this is something that you deserve and you should have. And part of our goal is to help you find that. Um, Not everybody, we know from our study and from experiences, not everybody with MCM or MCAP has prominent vascular anomalies or vascular disorders. But I think it is worth pursuing vascular anomaly centers if you are struggling to find care or struggling to find that medical home, because I think your odds are better than not that you would find someone in that team that has interest and willingness and ability to help you sort out the care that you need. It's not a guarantee, and not every vascular anomaly center is the same, and not every vascular anomaly specialist is the same, but I think it's a useful resource to have and a useful direction to go, especially if you're not sure where to go. And with that, let's talk about why we're focused on the challenges to care. So when Anna and I started working in the vascular anomaly space about 6 or 7 years ago, I guess, our first thought is we're really going to dig into communication because we were really interested in how do people get information, what are they learning about, what sources are they going to, how do they talk to doctors. And very quickly, what we learned from families is that communication was useful and important, but what was even more important was finding somebody to communicate with, finding your way to a doctor. And so we really shifted a big portion of our research agenda to focusing on what are the factors that are making it easier or harder to get the care that you need for vascular anomaly syndromes. And we'll go through a couple of different studies. This was actually a big interview study where we were able to map out the different factors that influence how well patients were able to access care. And some of them are obvious things. Oh, go back.
Sorry.
Some of them were obvious things. She's trying to throw me off. Like like the healthcare system. If you don't have the right insurance, you're not able to get in, or if there's a long line to get in to see the clinic, that's a problem. Also, individual characteristics of how strongly are people advocating in for themselves and pushing and willing to be the squeaky wheel. Things like social networks, like advocacy groups and communities, like MCM Network. Those are instrumental for a lot of families, especially those who can't find doctors that are knowledgeable. But there are also really concerning things like um, are you lucky? Did you happen to have privilege? Did you, by chance, were you born in the right town that happened to be down the street from the right hospital? Or did you just happen to bump into the right doctor who had seen an article or seen another patient with a similar disease? And all of this was influenced by the quality of information that was available and that was given both to patients, families, and clinicians. So that was the first kind of structured look at what are all the problems people are having and how might we be able to start targeting some of these problems. And then on the next slide, you can see we also wanted to know where can people go. So we, got into the field where we didn't even really have a clear understanding of who was providing multidisciplinary care for vascular anomalies around the country. And so we mapped out of the 200 children's hospitals on the map here, you can see every place in 2023 that said that they had a multidisciplinary center. There's a couple things to note here. One is if you counted, you would see 13 or 14 states that don't have a PIN. So 13 or 14 states that don't have multidisciplinary centers. The second thing to mention is that this is based off of whether the hospitals were advertising that they had a multidisciplinary center, but not every multidisciplinary center is the same, and not all of them have the same resources. So even this, I think, is potentially an overestimation of how good the care is that's available, or how widespread the care is that's available. And so then we wanted to dig in a little bit further and understand perspectives of patients and perspectives of clinicians. So on the next slide, you'll see we're summarizing a couple of surveys. The first survey was not done by us. This was done by some colleagues where they talked to, or they surveyed adult patients who had vascular anomalies. And they asked them, where do they get care, and who provides it, and what are the challenges? And what they found is that most of the adult patients were still seeing pediatricians because they didn't have an adult physician to transfer to. And those that aged out that could no longer see their pediatric clinicians, about a third of them just stopped looking for specialist care for the vascular anomaly syndrome altogether. So then we followed this up with a patient survey where we really wanted to understand which different factors were influencing how well patients could access care, and how those things were influencing mental health and physical health. So a couple things we found. One is that the better able people were to access healthcare resources, the better they reported their mental and physical health were. And also, the better the information and the better the knowledge of primary care doctors led to more ability to navigate that healthcare system as well. So showing that it looks like it's important not only to have information to patients and families, but also to support, community clinicians, primary care clinicians, so they can figure out how to provide the right care that they want to provide. So then we started talking to physicians, and we did a survey just last year of, in pediatrics, a lot of vascular anomalies care is driven by hematologists and oncologists, so blood and cancer doctors. That's what I'm trained in, and a lot of us are the ones that have comfort with the new medicines that are coming out. In the adult world, there's been much less recognition or interest demonstrated by hematologists and oncologists. So we wanted to kind of document the problem and figure out how can we maybe target that. And what we found was kind of stark. The vast majority of adult doctors that we interviewed, or that we surveyed, said that they, had no or very little knowledge of most diagnoses of vascular anomalies. They often reported that they had no education after medical school related to these. They had low confidence in providing care, and because of the lack of confidence, lack of knowledge, lack of resources, they had little willingness at this time also to say that they wanted to make this a major part of their career to care for these patients with these disorders. So again, a big, red flashing warning sign that we don't have the right workforce and we have a lot of barriers to overcome. And so next you'll see we dug in a little bit more to clinician knowledge, and this was through interviews, or through surveys and interviews with parents and caregivers. And what we found is that, clinicians' knowledge, experience, and the information they provide, pretty much all of them were influencing the patient experience. So the quality of how much your clinicians knew affected your ability to get a diagnosis, to get the right treatment, to get the right referrals to care, and it even had effects on your physical well-being and your emotional well-being. And the last point I want to make before I hand it over to Anna is what we've observed is happening in this field is that patients and caregivers really take on a huge burden to self-advocate, to push for themselves for what they need. And they're doing everything they can with whatever resources they can to access the care that they need. And what we found in our studies is that, that is part of the solution, but it's not enough to overcome these other barriers. And we need additional solutions, additional ways to bypass or go through or go around those other barriers that people can't just advocate their way around. And so that is how we started thinking about what steps can we take, what can we do to actually ease this pathway for patients and families. And with that, I'll hand over to Anna.
Thank you. So Bryan got to point out all the challenges and the barriers, and I get to talk to you about the ways that we identified what should we target to try to improve this. And by talking with patients, families, clinicians, we were able to identify 4 key areas that we wanted to target when we were developing a tool to try to help. So having access to better information, whether that's online or through clinicians, improving primary care physicians or clinicians' knowledge of the scope of vascular anomalies diagnoses, the quality of communication families are having with clinicians, and then access to specialists across the country, especially in those areas where there were shortages. And so these are the factors that we wanted to target as we developed a new tool. And so our solution is what we're sharing with you today is called VAccess.org. This is the Vascular Anomaly Care Access Program. And our goal is that this serves as a centralized hub for patients, families, doctors who do not specialize in vascular anomalies, and vascular anomaly experts. So everyone is coming together to have access to information and communication tools. So how did we do this? We developed VAccess using what's called participatory design methods. And this is where you bring in the people who will be using the tool to talk with them about what they need, what challenges they might face using it, how it can be most beneficial for them. And so this first aim focused on talking with primary care clinicians about if you're seeing this patient in clinic, how can this tool be beneficial for you? What information do you need? And so through a series of interviews, co-design sessions, building the website, getting usability testing, we developed what the final version of VAccess is today. So before I give a demo, I will highlight some of the key features. So when you visit the website, you will see that there is a section for patients and families and a section for healthcare professionals or vascular anomaly specialists. In the vascular anomaly or in the patient and family section, you'll find educational information, support resources like advocacy group, links for different tools or services that might be helpful. There's a Find a Vascular Anomaly Center that is available to anyone who visits the website, and then information and links to all of the relevant advocacy groups. So we hope you'll find information here that is useful. We also are in the process of continuing to develop this and working with you all to find out what would be most helpful in this hub. And so after we present today, I want you to be, open to sharing some ideas for us. The healthcare professional section is specifically designated for those clinicians who are not experts in vascular anomalies. We developed clinical information for them that are handouts on different diagnoses, management, treatment, how to approach their workup. There's an Ask a Specialist tool, which we are very excited about, where they can send a request for a specialist to give input on a case that they're seeing. So they can share de-identified information, maybe photos, and get input on what are the next best steps or where should I send this patient for a referral. And they also have resources that they can share with patients and families. And so this is dedicated for healthcare professionals, but we want to share it with you so you can make sure the doctors that you are seeing, the doctors that are on your team, are aware of this and can use it. All right, so there is a QR code, or you can type in vaccess.org if you want to follow along, but I will go ahead and open the website up briefly. So this is vaccess.org. And like I mentioned, there is a section for patients and caregivers, non-expert clinicians, and then the vascular anomalies specialists. Each of these cards has unique resources, educational materials, the Find a Vascular Anomaly Center, and links to other resources. You click on educational materials. For patients and families, we linked to several credible hospital websites that give overviews on the various diagnoses. Healthcare professionals have a very similar tab where there is educational materials that our team has developed that gives tips for managing these conditions. The Find a Vascular Anomaly Center has a map of all of the vascular anomaly centers that our team was able to identify. It's searchable by zip code. You can use the function to find the nearest one to you based on your computer's location. We also tried to include tags like pediatric, or if they see adults at the children's hospital. And again, this is an area that we're open to feedback of. What are the most useful search filters? What are the ways that we can make this tool most beneficial for you and for your family? All right. And what we have for you that we hope that will be useful for you as you're seeing your different clinicians under patient and caregiver resources, there is something here that you can give to your primary care clinician. It is a flyer that includes how to access VAccess, what it is, and where they can find more information. So feel free to share this with anyone that you think would benefit from seeing the website and potentially using the Ask a Specialist tool. All right. So what's next? These are our ideas for how we make sure that this site is useful and helpful, but we want your ideas. So our thoughts are that you could share this with your primary care clinician. You could share it with other specialists who may not be vascular anomaly experts or MCM or MCAP experts, but might need some resources. If you find yourself in emergency care or urgent care, sharing it right there to be able to make sure that somebody knows what's happening. School nurses might benefit, sharing it during a hospital stay. So we'd love to hear from some folks on the call, either in the chat or if you want to open your mic. What are some other ways that it might be helpful for you?
Brittany, do you want to go? Before you talk, Brittany, I just want to remind everyone that this is being recorded.
Thank you.
And I'm not exactly sure yet if we're going to put this on YouTube or if we'll make it available by request. It would be nice if we could put it on YouTube, but I want everyone to be comfortable speaking frankly. And so if that is in conflict with us putting this on YouTube, go ahead and speak and we can edit out, your section later. I have an editor. So and if that isn't comfortable, you can put it in the chat. So I just wanted to sort of lay out the ground rules and make sure we're comfortable and we all know what's happening before we start talking.
Yes, thank you.
I would like for us to all be able to have a comfortable conversation. Okay, I'm done. Brittany, do
No,
you want
thank
to
you
go
so
ahead and
much.
ask your question?
Yeah, so I'm an MCAP mom. My son Elliot has MCAP. I'm also a psychiatric nurse practitioner. Obviously, that's not going to be our primary specialty that a lot of these people are accessing, but psychiatry, mental health is going to be something that's affected, obviously. As a psych provider, would I be able to have access to the provider side of things, or is it going to be specific to any type of provider?
No, you can absolutely have access to it. Bryan, do you want to elaborate?
Yeah, and there's two different aspects to this. So we lump them together for simplicity, but there is the resources that are available to clinicians in the community that's going to include, accessing clinician-specific resources, ask a specialist, and then there's the actual vascular anomaly network, which is for researchers and physicians who and other clinicians who have demonstrated an ongoing interest in the field of vascular anomalies, whether in advancing clinical care, advancing research. I think certainly you could have access to the clinician materials that we have for the community clinicians. Really, most of those are, most of those are publicly available anyway. The only thing that would be hairy is I would not want you to submit and ask a specialist request about your son because that would be more of
Yeah.
a direct, clinical relationship as opposed to giving educational guidance to a clinician. In terms of the vascular anomaly network, if you have, a strong interest, absolutely mental health and emotional well-being is really important and under addressed in this population. So absolutely, you'd be more than welcome to apply for that as well.
Mm-hmm.
Okay. Thank you.
Thank
I
you.
also
Nice to meet
would
you.
like to say Audrey's statement about early intervention. I think that's a really good place to provide that information to all these, statewide early intervention plans. And we actually had Elliot's ARC meeting to transition from Keys, which is Kentucky's early intervention, to preschool, and got to educate the school psychologist and everyone in on that meeting about MCAP and why his delays kind of present complicated, some that are very significant and some not very significant. And I think that schools would be also a place where this information would be helpful.
Yeah, can you tell us more? What would be, is the resource like how to advocate for your child's early intervention, or is it giving the schools what the considerations they have? What do you see the materials actually being that would be on the website?
Yeah, just understanding of what the delays might be, how best to support those delays in the school system or in early intervention programs, which, for instance, like Elliot struggles with feeding difficulties, and that was identified as an issue pretty early on. And I actually didn't know until recently that we could have been seeing nutrition through early intervention, which would have been nice, especially now that we're starting to see that he can do some purees, just understanding how at this age, what he would need as far as caloric intake and macronutrients versus what a typical 1-year-old would need as far as
Mhm.
purees, because that obviously is different. So
Wonderful. Thank you so much.
I will just say I've spoken to people in the vascular anomalies community more broadly, and there are certainly vascular anomalies specific issues that are relevant to IEPs in school that might be a little different from the delays that are things about being able to elevate a limb or move around or fatigue, um, the reasons for fatigue.
yeah.
That actually might be something that overlaps with our population too.
Mhm.
I think
Um,
that's a good point too, Christy. One of the things they brought up whenever we were transitioning from like the IFSP for keys, really all of the information in our keys paperwork was just about delays. They didn't have a lot of the medical information in that particular note. So when we went in for our initial meeting, they were kind of blown away by the medical side of
yeah.
things, but understanding that kids that have vascular anomalies conditions might need their IEP to be more other health impairment versus developmental delay. Because if it's a developmental delay, that IEP only lasts through age 9, was my understanding, versus the other health impairment is any time during their educational career they can have that.
Yeah, that's an important distinction.
The other thing I would bring up as we're going to be going through some ideas already, every idea brought up has been really helpful. This is a working framework and a working tool that we can change over time. And if there's something that, MCM wants to develop that's going to be helpful, and we can just be an extra dissemination arm where, we can just post it and link to it so we make sure people get it, or if there's resources we can provide to help Christy in your group to develop materials, like just because it's not on the website right now, or even if it's not specifically vascular anomaly associated, if there's things related to MCM and MCAP that are neurological, neurosurgical, if we can help develop materials and help, get them out there, we're totally interested and flexible with that.
Well, we have a huge need for that. But part of the problem is that the data is not very well established. Like
Mhm.
we have as a community, we sort of know, but as you just demonstrated, so I'll just say for the group at WashU just evaluate our patient contributed data to better characterize the syndrome. And there's so much more complexity reflected in that data than is really documented in the medical literature. And as a community, we know this, but it makes it complicated to develop guidance, I think, until you have the evidence, or at least that has been my experience trying to get people to do this for us. So I just wanted to mention that we have another caregiver emphasizing fatigue, and probably this is something that the fatigue in particular is where some of our patients with better physical function are going to overlap more with the broader vascular anomalies community just because they're more active. Like my daughter goes to school in a wheelchair, so we're not going to really be talking about, nobody's expecting her to move around like a normal
Mm.
person, whereas the kids who have, more typical physical function where you can't see, that there might be
Mhm.
limitations are going to encounter this misunderstanding more than the more
Mhm.
severely affected patients. Jessica has a question in the chat.
Thanks for highlighting my question. I am in Florida and I think that the website looks fantastic. It looks great. I was able to hop on for a couple of minutes. It's clearly organized. I think it looks really easy to navigate. I think it's fantastic. I just was wondering, I take care of my sister Sarah. She's 29. We were able to get some pediatric care before she became an adult. And it was kind of through word of mouth through another mom in our MCM parent group on Facebook. And I love the fact that there's a directory now. And I noticed that there's two places in Florida for adult care. One of them I'm like a little suspicious that they actually provide adult care because of my experience with them already.
Mm.
However, I just was wondering if there is a review section or maybe a comment section. Like, let's just happen to say I go to a provider and I have a fantastic experience. They provided care for my adult sister with MCM, and maybe I can express that it was such a positive experience, easy to schedule. Is there a way that I could leave that feedback for another family who might also be trying to find care at that same facility?
I think it's a really good idea. We don't have that built in yet, and we'd have to think about what the best way is to do that and where the best place is to put that. But I think it's certainly an idea to carry forward. Because another question we have is right now the patient-directed resources are a little bit bare bones, and we've got plans where we're going to start building some additional educational tools and things like that. But this may be something where it'd be useful in the patient and family section that there's, a discussion board where you can have a tag specific to centers or something. We have to think about where it would go, but I think it's a really nice idea because just picking blindly from a list doesn't feel that informed.
I'll just follow up with what you're saying. I'll just give you a very quick example. There is a Nemours is listed in Florida
Hmm.
as one of the sites that has limited services for an adult. And I would provide feedback if I was able to, that I actually was able to schedule Sarah at Nemours after age 18, but I did it through like a special approval process. If you
Mm.
initially call and say, I have an 18-year-old who would like to get in with your vascular interventional radiologist, the scheduler would tell you, I'm so sorry, she's 18. That's not
Mhm.
possible. We won't allow you as a new patient. But on the back end, I was able to actually successfully get in and schedule. And I would leave that feedback for another family to say, hey, don't be discouraged. They do offer services up to age 21, but when you initially call, you might have this experience, but here's a different route you could take to get
Mhm.
the service that you're looking for.
Yeah, I think
Yeah,
that's
that's wonderful feedback. And we heard from the primary care clinicians that that's helpful for them too, right? When they're choosing a site to refer somebody to know kind of not the main hospital line to call, but what's kind of the back door in, what's the secret to making sure patients are seen and making sure that they can get in. So that's extremely helpful to know.
Yeah, actually, I always ask if I'm trying to get someone into a VAC, I ask for their intake person. I don't, is that
Mhm.
listed right now on VAccess, like the intake person?
we put whatever contact information the center told us to use. So sometimes
Okay.
it's a particular person, other times it's a central call line, but it was at
Mhm.
the discretion of each center to decide.
Yeah,
Even
and we
late.
called them directly to say, what's the best, if don't call the central line, call this number, email this person. So we asked them for whatever the best option was.
So even if it were labeled that this is the intake person
Mm,
versus I mean, sure, the
that's true.
person could
Yeah.
call, but knowing that I'm being provided with an actual intake person is encouraging and might make
Yeah.
me
Yeah.
more likely to use that. I had this feedback about I also thought that this tool was potentially helpful, but also a little fraught in terms of it being really hard to tell if they had the right specialists for, your particular condition because vascular anomalies is a broad category.
Mhm.
So there's probably some things that could be refined, but as
Mhm.
a first draft tool, it's pretty great. Joanna, if you want to talk, you certainly can, but this is pretty straightforward. She's just asking if there's a way for interested clinicians and caregivers to sign up for email updates.
Thank you so much. We're in northern New Jersey. My daughter's 12. I'm an MCAT mom. For 12 years, we've luckily had the same pediatrician who's not super familiar with the condition at all, aside from what we bring to her, which I know is a very common experience here. We're involved in the vascular clinic down at CHOP. We're down there like once a month at this point for various reasons. But basically, my overriding thought here was for the clinicians who don't necessarily have a lot of people with these issues, so they can just have that at the forefront of their brain. They see other kids with these issues. Oh my gosh, I know I've seen that somewhere, because we've just, for 12 years, it's just been so much of us having to do so much of the research and us having to go to the group, which has been invaluable. I've said that so many times, Christy. It's amazing what kind of information we get from that group. Has saved, our daughter's life a few times, but just to kind of keep some of these issues, at the forefront. And so if something comes up and they just get like a little ping, like, oh my gosh, okay, yeah, I did see like Lena had this happen. They weren't sure what to do about this, so I can kind of direct them. But just a thought.
That's an awesome idea of an
I have
obvious thing that we hadn't thought about at all. I love that idea, and thinking through how we would do that. But one idea that we had is specific to kind of new advances, new research, new updates, things like that, of having folks sign up for those updates. But I think also that's a nice idea of just, there's a new posting on the website, or we're adding this new tool. I think that's a really nice idea.
Leslie, do you want to ask a question? She says, I was looking for the vascular anomalies clinics in my area. Some weren't available on our initial journey, and some had no desire to see us, mainly because our main issue was neurosurgical. Do you feel, as vascular anomaly specialists, that vascular anomaly specialists are uncomfortable with patients with neurosurgical issues? Also, we were unable to find a clinic willing to prescribe medication, but are seen at a PIK3CA clinic that is not on the list. I think the majority of the MCM patients here are seen at that clinic. I think that's UCLA. Is that? Yeah. And so they have a geneticist there who's like an overgrowth person. I think the majority of MCM patients here are seen there, and we're seen at multiple facilities. That's the whole comment.
I think a couple of things. One is, I think this is changing a little bit because alpelisib has only been around for a few years, and I think as approvals have been getting easier, and as hemonc doctors and VACs have been getting more experience, my sense is that people are getting more and more comfortable prescribing that medicine. So that's part of the answer. Part of the answer is it depends who you bump into, and is that clinician willing to be a medical resource for you, even though they don't have the treatment options that you need? I can't speak for every VAC. I can say for ours, our approach is, number one, we have the benefit of having a geneticist embedded in our team. But number two, we also just made the commitment that we consider MCM and MCAP a vascular anomaly disorder, even if the vascular anomaly is not the predominant symptom or the predominant concern. And we have the staffing and the resources to help kind of get you to that other care. Because I'm just going to make an assumption, but I'm assuming that it's really hard to get a neurosurgery team to help you coordinate things that aren't neurosurgical. And it's probably hard to get an endocrine team to coordinate things that aren't endocrine. So I think our job is to continue pushing within our expert networks of vascular anomaly specialists that, this needs to be the expectation that if you're a multidisciplinary center, that you take care of everybody. But we're not there yet. I suspect it's moving, but not necessarily quickly enough.
And this might be a place where noting the specialties that participate in the clinic would be helpful for people
Yeah,
navigating now.
absolutely.
And what we had discussed earlier is that some clinics just dump every specialty like on their website. And it's not necessarily reflective of their sort of primary interests, but it would be at least some information that would, I think, help.
And one of the things, with the Vascular Anomalies Network is within VAccess, all of those specialists and researchers who are really dedicated to this population or these populations. One thing we're doing there is we're going to develop a consensus on what we mean when we say multidisciplinary care and what we mean when we say interdisciplinary care. And I want part of that definition to be that you are becoming that specialist medical home for a patient, and you're not just fixing one narrow issue. You are serving as more of a resource. And so if we can, work from all directions, but I think if we can start generating an understanding in our field of what we mean when we say we're a multidisciplinary center or an interdisciplinary center, and what expectations that should bring, I'm hoping that can slowly push in that direction as well.
I had told you guys before the chat that, or before we started, that I had some international participants sign up, and they're actually not here. But just so that we can document that discussion, the physician resources are not. Right. Do you want to talk about that for a minute,
Yeah,
Brian? Or
sure.
what?
The design of VAccess was really to be kind of a US North America focused resource. So when Ask a Specialist requests come in from other countries, we're not planning on responding through that platform. However, what I can say is really for any patient or caregiver or clinician around the world, you can email the support at VAccess, and that goes direct to our admin team, and that email goes direct to me as well. So anything that arises where you have questions about things, or you want to get access to more resources, whatever it is, you can always reach out through that email and get in touch with the core team to figure out where we could point you. The other thing I would bring up is that we have an upcoming collaboration with MCM on a research study where we're going to be trying to really characterize from your voices and from your perspectives what are the good, bad, and ugly of managing these disorders, of trying to navigate care, of trying to get information, of trying to communicate. As we've mentioned, there's overlap, but there's also distinct things about MCM and MCAP versus all other vascular anomalies. And one of the challenges in research is that if I want to get a grant to try to fix a problem, I have to convince the people who have the money that it's a problem. And so this will be a really important project for us to really lay out what's working well, what's not, and how can we start coming up with more solutions to make care easier to access, and identifying areas where we need more research. So that we are submitting our approval stuff soon. So hopefully within the next few weeks, we'll be able to start recruiting, and it's going to be interviews with parents or caregivers of patients at any age, and then for any adult patients who have the kind of the ability to meaningfully interact and be part of that, they're more than welcome to be part of those interviews as well. So stay tuned with that. You'll be hearing more from that, but we're hoping that some of you would be interested in sharing your stories and your experiences with us.
Brian, do you remember the recruitment numbers you were looking for?
We were planning for about, initially we were saying about 20 caregivers of pediatric patients, and then 20 either adult patients or caregivers of adult patients, or a combination of them both together. So about 20 kids and 20 adults represented is our plan. So 40 total.
So the study is designed to really capture, there is some design in the study to capture the adults, which we
Yeah,
had
absolutely.
discussed was a real hole for us
Mm-hmm.
in
Yeah.
understanding.
And we really thought through this a lot because um, I don't know many adults with MCM or MCAP, so and I know that that's kind of the spectrum of how able to interact and communicate can be wide. So we really wanted to focus it on um, make sure we capture the caregiver perspective, and if there's adults that are able to independently interview, we've got that written in. And if they're not able to be independent, but they can provide some meaningful insight in addition to their caregiver, we can do those together. So we've written in a lot of flexibility to really adapt to whatever that particular family's needs are.
To sort of jump back to the VAC's interest in MCM, MCAP, the vascular anomalies specialists have been more welcoming of patient advocates than other areas of medicine that intersect with MCM. And so for the entire time, almost the entire time that I've been involved with the MCM network or running the MCM network, I've been attending expert meetings with the vascular anomalies doctors and sometimes researchers. And for many, many years, I would feel like, why am I doing this? Because they're never, ever talking about our patients. And then when alpelisib was happening, they really involved us in that process. And now that our patients are able to get medical treatment, there's a huge change in the interest and discussion. And for the I'm seeing a big change in the interest of experts in our population. So I just wanted to acknowledge that this has been a like kind of a difficult home place for us, but I really see a change in the interest and the experience of the professionals involved in terms of our population. Oh, so Jessica has a question. And Brittany, I see you just came on camera. Did you have something to say also?
I was actually going to comment on what Jessica was saying. It would be nice if on like the provider or patient resource page, maybe there was access to like, I keep a blog about Elliot's Care or any like other families that do that, just having access to that too. So, people can have other people's experiences to kind of understand what they may be looking at.
That's wonderful. We had been talking about building a kind of share your story section, but I also like the idea for those of you who have established narratives or blogs or things that are ongoing to be able to provide links to those as well.
If anybody has those things and you want to either send them directly to us or through Christy, we could very easily make a new, tile
Mm-hmm.
within the parent and caregiver or patient caregiver resources. That's a list of links to certain things, to different blogs, different stories, etc. And I
Yeah.
do think eventually, I think it would be nice to have kind of a story repository that we could tag with the different whether it's about MCM or MCAP or whether it's about transition, whatever it is, because I think, and it's not every family, but I think there are some caregivers that really benefit from the solidarity of knowing they're not alone in that journey and being able to, as you wanted to, scroll through and share your story, read others. I think would be powerful. We're still early in our thinking about that and would love, feedback on if that would be useful. But that was another idea we've been chewing on in the last week or two.
I know from just like the experience with the MCM network and then the PIC3CA Facebook group too, like
Mhm.
those have been substantially useful. I mean, we were struggling a lot financially with the cost of Elliot's Care. We've got insurance, but it's, high deductible plans and we were missing work and all those things. And it was actually another MCAP family that was like, have you looked into Medicaid waivers? And I almost
Mm.
felt kind of silly because like I've done case management before, but it just like hadn't even crossed my mind that, oh, maybe he would be eligible for a waiver. And I mean, that's been so helpful because not only does it help cover some of his medical care, we're able to get into a medical, like pediatric extended care facility for daycare. We were at the point of almost being kicked out of daycare because he couldn't eat. And it was like, well, what do we do if we can't go to daycare? Like, we both work full time. Like, so, just seeing those other experiences and having parents be like, oh, yeah, we did this and we were able to get this covered. I mean, substantially helpful, like, brought down the emotional stress a lot. Just knowing that there were services out there.
One approach we could take for that is identify really key topic areas that parents really wanted or needed help. And because it's a little daunting when you go to a patient or a parent and say, "Hey, just write a story about your experience." It's like, "Oh gosh, I'm staring at the blank page." But if it was, write your story about transitions in care, write your story about, financial challenges related to this or that. Like maybe if we could identify these are really key topics that people are
Mm-hmm.
looking for kind of new ideas or insights or guidance on, maybe that'd be a way to give a little more guidance on how people could share those stories.
Jessica would like to share a story about transition. Jessica, go ahead and hop on.
Thank you. I appreciate it.
Yeah.
I want to point out that by giving caregivers a directory, by giving caregivers resources, information, you're putting power back in our hands. And I really appreciate that because we have to rely on specialists and doctors, and sometimes they hold all the power, and then we're just left feeling confused, not sure where to turn. Here we are going back to our patient groups, asking other people for help, or do you guys know anyone? Or it feels confusing at times to navigate a system That's so complex, and you're just a parent or a caregiver trying to survive the day to day. And I really want to say I appreciate it and just highlight very quickly like a story about Sarah. Sarah was diagnosed later in life, 18 with MCM, and she had never seen a vascular doctor, but she had had a stroke when she was younger, and she had developed seizures around puberty. So when we found out she had MCM, it was a big concern to just at least get her evaluated. And one of the clinics that you have listed on your directory, we took her there for pediatric care, and we got connected with hematology. They were really the ones focused on, she has a blood disorder and clotting issues in her vascular system. And because of her age, they were like, hey, we need to transition her to a team in the adult world. So we lost this wraparound services of this large children's hospital. We went over to the adult world, and I remember seeing the first hematologist. He was nice, but kind of confused. And then he said, hey, I'm going on vacation. My office will call you to set up an appointment. Like, he didn't want to schedule a follow-up appointment with us. He didn't want to do blood work. He did nothing. And I get a call from the office, and they say, hey, actually, he's not going to see Sarah again. You're going to see our director. And I was like, oh, okay, maybe this is moving in the right direction. Like, maybe this is a good sign, right? We're on the adult side, and we're getting moved up to the director. I take Sarah with her nurse, and we are in the room for this follow-up appointment, and we're talking to the director. And I don't know if I was more angry or sad or confused, but he said, no one here can help you. We cannot help you. I don't have any local doctors to help you. You, as the caregiver, need to contact the NIH and find out from them who can help Sarah. And I left just feeling so confused, frustrated, all the feelings. And for many years, she's had no follow-ups, no specialist care in this area. And I'm pointing this out to say, had I had something like this as a directory, or had I had something like this as a way to turn to, I think I would have been felt empowered in that situation and said, well, did you know there was this website? Did you know that there's this information that you actually can go and access? You can contact other specialists. There's just so much burden on caregivers. There's so much stress already on us. And recreating the wheel in the field of the adult care world is just, it's a burden. It feels very overwhelming. So thank you for like giving us a tool, because we need it. We need it. And I appreciate all your time and hard work that has gone into this.
Thank you.
Wow.
And thank you for sharing that experience.
Yeah, that's I'm sorry you went through that. That's
Mhm.
this isn't going to shock you, but that's terrible, and that's what we hear from a lot of people. So like it sucks that you're not alone in that experience, but that's really what motivated us to do any of this work is hearing those stories over and over again. It's heartbreaking. I mean, it's not fair. One thing that we also are working on and looking for funding for is developing a whole kind of curriculum and workforce development for adult care, because part of the problem with transitions in care is if you don't have anyone to transition to like you experienced. And I'm at our center, we're really privileged because number one, they let me in the children's hospital see any age, which isn't universal. That's a lot of places don't let their doctors do that. And we have an adult hematologist who's a core member of our team and is really interested in our population. And but again, that's not the case everywhere. And part of the challenge is it's an even bigger burden when you're told to go find adult care and adult care doesn't exist. So that's another, we've got ideas lined up, and we'll keep banging the drum to find the right funding source for that. But that's another thing that we really need to do
Mhm.
is incentivize and motivate and make it easier for adults to take care of patients in this population. And it's got to be getting them interested and getting their bosses interested so their bosses can see that, things that are uncomfortable to talk about, but like, hospitals make money off of imaging. Hospitals make money off of prescribing expensive medicines. Like figuring out how do we make an argument that's going to appeal to, the research interests and the altruism of the clinicians themselves and appeal to the decision makers who are deciding, where that clinician's permitted to spend their time. So it's going to be a long process, but Jessica, it's stories like that that are really motivating us to do this work. So thank you so much for sharing that.
I think that's a nice way to wrap up. Oh, not nice. Nice isn't really the right word, but an appropriate way to wrap up. Although I don't want to cut anybody off. If anybody, this is like your last chance. And also, if anybody wants to, people can reach out to
Mhm.
VAccess, to their team, and you can reach out to me if you have any questions
Yeah,
about
please.
all of this. Um, and this study that Brian was talking about will start recruiting, I guess, in the next few months, I imagine.
Mhm.
Yep, we are hoping
Okay.
to have the IRB approval probably in about 2 to 3 weeks, and then right when that's approved, we can start recruiting.
So I'll be sending recruitment materials through the contact registry. So you'll be notified about that if you're interested. All right. Well, thank you, everyone. I think this went really well, and I really appreciate everybody's involvement and comments and
Yeah,
thank
thank you
you.
for having us, and thank you all for being here.
Yeah, thank you for doing this.
Hopefully, we get to talk to a few of you for our next study.
All right.
Bye,
Take
everybody.
care,
Thanks a lot.
everyone.